If you want to get a physician riled up, just start talking about prior authorizations.
Welcome to Off the Chart, a business and medicine podcast featuring lively and informative conversations with healthcare experts, opinion leaders, and practicing physicians about the challenges facing doctors and medical practices. I'm your host, Austin Littrell. This episode features a conversation between Medical Economics Managing Editor Todd Shryock and Dr. Heather Bassett, Chief Medical Officer of Xsolis. Dr. Bassett joins the show to talk prior authorizations and how technology could change the game.
I'm here with Dr. Heather Bassett, Chief Medical Officer of Xsolis, to talk about the prior authorization process and how technology might be able to help. Doc, thanks for joining me.
Oh, well, thank you for having me. I'm excited for this conversation today because it's definitely top of mind of a lot of physicians.
So, from a physician's perspective, what are the biggest pain points today in the prior authorization process?
Yeah, so I think I'm a data person, so I think just hearing some of the numbers really puts into context the pain points that physicians have. So if you think about Medicare, approximately 60 to 70 million members are enrolled in either MA plans or traditional Medicare. And roughly half of that is actually Med Advantage plans, and it's growing every year as we have a increase in our aging population. What you end up seeing in the MA plans is approximately 50 million prior authorizations in 2023. That relates to roughly 2 authorizations per enrollee. If you look at traditional Medicare, because they don't require prior auths on nearly as many procedures, medications, hospital stays, skilled nursing facilities, it's 400,000 authorizations in 2023, and it's 1 authorization per 100 employees. So there really is this imbalance in Medicare Advantage and just a tremendous volume of prior authorizations. And it's a huge pain point for physicians. It's a very manual process. If you talk to them, a lot of these are done over the phone. So that is very time consuming. They don't always know what the rules are. And it depends on which, insurer that you're working with, how they, what their requirements are, what they are kind of grading you on as to whether it is authorized or not. It's also hard to explain to patients. So patients, you then have been these conversations with patients, and they don't understand why they couldn't get the medication you ordered, or they get a bigger bill than they were expecting. So I think those are just some of the many pain points. If you want to get a physician riled up, just start talking about prior authorizations.
So, how is technology currently being used to streamline or automate the prior auth process?
Yeah, it's a bit of a hodgepodge right now, and that is because there's really no consistency or standardization out there. Again, if you're working with each of the Med Advantage plans, for example, the Blues, each Blue is kind of their own entity, and they have their own way that they do things. So even within MA plans, there's a lot of inconsistencies. So it's very hard to put technology layers in place to help. And again, I'd mentioned, you're on a phone, a lot of times faxing things to payers. That being said, there has been a push to improve the process. CMS has gotten involved as well, put a lot of requirements in place around interop and prior auth. They had a final ruling that came out in 2024. In 2026, plans are having to be more transparent, and they're having to, in 2027, be compliant with APIs and the way that data is processed between payers and providers and providing payers. So that work has started to move in that direction. I mean, what's pretty heavily used are RPAs, or robotic process automation, which is able to help with simple tasks, simple repetitive tasks. You see a fair amount of that. You're starting to see kind of data pipelines between payers and providers being built. Like Availity is one of the companies out there that's doing a lot of work to bridge data sharing. Payers themselves are creating portals, so you're logging into portals instead of getting on a phone or faxing information. So it's starting to see that pieces of automation come in. But again, very difficult right now because of every payer does it a little bit different. Hospitals have different EMRs, so that inconsistency just makes it challenging.
AI is everywhere now. It seems like every day you're reading about a new AI device or technology. Can AI step in here and help reduce these administrative burdens and make this process better?
Yeah, I think AI really is our best opportunity to start to move the needle in this space. Because I mentioned like RPAs, they were very good at repetitive tasks, or even is some natural language processing that's helping to scrape information, but it can only take you so far. The advantages of artificial intelligence is you not only have your predictive machine learning models that can help, you know, help you understand if a case is likely to be approved or not. But you're starting now to see generative AI. Everyone's kind of heard of Chat GPT. That is kind of taking things to the next level of being able to summarize clinical information. We as a company have been pretty intentional around artificial intelligence because again we've been using it for a little over 10 years now to help provide efficiencies for our clients, and we're one of the few vendors that has actually decided to sit between the payer and the provider. And AI has kind of been that neutral space that has allowed us to drive efficiency. So using machine learning to identify cases that can be identified as being able to be automatically approved. And so we've started to see it, but I really think we're kind of at the precipice of jumping off and seeing quite a bit of automation in this space, which ultimately will benefit not only physicians, but we're really talking about the patient and better outcomes for the patient, and kind of getting them more transparency and less healthcare is confusing for a patient, and how do we make it less confusing for them?
We've seen stories of insurance companies issuing mass denials using technology. Is that a risk of relying too much on automation? And are we going to get to a point where it's just the payer's use of AI is canceling out the physician use of AI in prior authorizations?
Yeah, I think part of the prior authorization process is claims get denied, and then the physician, the hospital has the opportunity to appeal that. And one area where we're seeing generative AI is creating appeal letters, as it's very good at summarizing clinical information. So you kind of wonder if the physician or the hospital is creating using generative AI to create an appeal letter, and then the rebuttal coming from the payer is, are we going to enter into the battle of the bots in those types of scenarios? I don't know. But if you kind of take a step back, because I mentioned there's a tremendous volume of I think it was 50 million prior authorizations in 2023. Of those, or if you speak to physicians, an average physician does 39 prior authorizations a week, and it takes roughly 13 hours between the physician and their staff to take care of those authorizations. Of authorizations, roughly 7 to 10% are denied. So that does mean 90% are approved, very manual to get those 90% approved. So if you're able to use AI to kind of tackle that portion there in and of itself, regardless of if there are some, slight increases in denials or other kind of things people are worried about, you're going to see tremendous benefit from a physician, from a hospital standpoint in automating the large number of prior authorizations that are approved.
Say, Keith, this is all well and good, but what if someone is looking for more clinical information?
Oh, then they want to check out our sister site, patientcareonline.com, the leading clinical resource for primary care physicians. Again, that's patientcareonline.com.
Do these technologies need to integrate directly with the EHRs and the insurance systems? And what's the biggest challenges to doing so?
Yeah, the short answer is yes. We've got to get away from phones, from fax. I mean, we're in 2025 and still talking about fax machines, which is crazy. I'm sure you remember. I still have the voice, that sound of a modem and a fax machine ingrained in my brain. But the EHRs are where physicians work, and it's also where the data lives. So regardless of whether you're fully integrated into an EHR from a vendor standpoint or through the EHR itself, or whether you're more of a bolt-on or just getting data that's applied elsewhere, you need to be integrated to get real-time clinical data. Because if you don't have real-time clinical data and being able to make proactive decisions, you're not going to be effective in this space. The other thing, you mentioned the payer piece. So, obviously providers don't work in a bubble. There is that integration with the payer and the back and forth and sharing of information. And so you also need that integration on the payer side. And fortunately, work is being done in that area. I think it's going to take us a little longer than we would like for that to happen. And again, part of the problem is on the payer side, there's a lot of old tech out there. And in order to get to the more modern ways of exchanging information and taking advantage of standard FHIR APIs, which is kind of what is really leading the charge in interop and standardization. There's a fair amount of work that's going to have to happen in a short period of time to get ready to be able to have that type of data exchange and layer these efficiencies.
How much time do you think an automated prior auth process could save physicians? And are there any new challenges that might come up? There's always the law of unintended consequences. Are there any new things that might come up that physicians would have to deal with as a result of an automated process?
Yeah, I think there's there's some numbers out there that say you could save 70 to 80% of time that physicians spend on prior authorization. So there's definite opportunity for a big win. I was it's part of the reason I ended up working for Xsolis is I was really starting to lose the joy of practice. Because there's so many administrative layers, whether it be prior auth or other things that physicians end up having to do that takes them further away from the patient. So being able to decrease, administrative waste, whether that be prior auth or other tasks that physicians have to do, and get them back to the, in front of the patient, and the whole reason we went to med school to take care of the patient. I mean, that's a huge win. But the counter to that, you mentioned, are there any new challenges? The counter is adoption of new technologies. It's hard, physicians, we can be a little stubborn at times. You kind of develop what you consider a very good process to be as efficient as possible, and getting, it's that change management piece, and getting them to use, because sometimes you're a little bit less efficient before you're more efficient with new technology. So there's that utilization piece. Another big piece that we're seeing around artificial intelligence is trust. Like, how can I trust that this is going to do what you say it's going to do, that it's not going to create more work for me because of errors? So there's that trust piece. And I'm a big proponent of responsible AI. It's part of the reason we joined CHI, the Coalition of Healthcare Alliance, this year, is that in order to get that trust, to make sure you have best practices in place, so that we actually are able to do what we want to do, you have to be considered of responsible responsible AI, which is weighing rewards versus risk. When you think about innovation, it also creates an environment that allows the physician to gain trust, or whoever the end user is, by understanding these processes are being put in place. So those are some of the things I think that'll be challenges and what we need to consider as this technology is rolled out in the future.
Does the technology help reduce the number of inappropriate denials, or is it making appeals more complicated?
Yeah, that's an interesting question. I do think it is decreasing the number of denials, and it's one kind of metric that we look at as a company is, how do you put processes on the front end to prevent denials on the back end? Because some denials happen because you inappropriately tried to authorize an inpatient when the patient really never met that benchmark. Sometimes it has to do with missing clinical information. Sometimes timing plays a role in it, or you're not holistically looking at the patient and making decisions. So a lot of what we do is actually centered around appropriately getting the patient in the correct status and preventing denial. So there are a lot of use cases out there where artificial intelligence is being used, machine learning, predictive models being used, that do help prevent denials. And then on the second part of that was around does it make appeals more complicated? I don't know that it makes appeals more complicated. I think we're still going to have denials. Like, I think denial sometimes is seen as a four-letter word, sometimes by hospitals and by physicians. In the current environment, denials are part of the process, and you have to be willing to accept that a denial is going to happen, and put processes in the back end to address it, and not be afraid to address it, because 80% of denials are overturned, which in and of itself, speaks to the broken process. So I don't think it's going to make them more challenging on the back end. I think we just have to be, while we're helping on the front end with prior auths, know that denials are going to happen, and it's another opportunity for AI to play a role in the appeal process and help streamline that.
Oh, you say you're a practice leader or administrator? We've got just the thing. Our sister site, physicianspractice.com, your one-stop shop for all the expert tips and tricks that will get your practice really humming. Again, that's physicianspractice.com.
Yeah, the AI has completely exploded. It seems like it went from this here's this new novelty technology to now it's ingrained in everything. What do you think prior authorization will look like 5 to 10 years from now?
Yeah, I think that's a great question, and I can, I definitely can geek out on the AI space. I mean, I think I'm, one of the last generations of physicians that learned the way I learned, and treats patients the way I think things are just inherently going to change over the next couple of years. And I think, I'm very interested to see how it lays out. I'm a little jealous, I'll be honest. I think it's tricky in the 5-year space. I am, concerned about some of the changes that the new administration is putting in place, because, and my concern is that what's going to happen is more there's going to be a shift, and unfortunately, I feel like healthcare may end up being more pressure put on in the healthcare space. And when you start to put pressure on the healthcare space, COVID is kind of an example of that. You put pressure on the healthcare space, the innovation piece kind of tends to be moved a little bit to the side. And so I'm a little concerned about that. I guess, we will see how that plays out. If you put that to the side, we have actually seen a lot of investment in innovation by healthcare organizations out there, more so than we've seen in years. And it's because they recognize that innovation, particularly artificial intelligence, is how we're going to fix problems like prior authorization. We're going to fix problems around clinician burnout, like physicians are leaving the workforce, nurses are leaving the workforce, and I mean, staffing challenges are real, and have the potential to decrease quality outcomes that we as patients expect from the healthcare system. I do see the generative AI piece expanding. There's generative AI is very good at summarizing clinical information, which can help with crafting how the information you send to the payer to get the prior authorization, helping with appeal letters. And then if you kind of go to the next step, we're hearing a lot about ambient AI, and it's really kind of in the environment, and passively taking information and then adding context to it. There's a lot of quite a few companies out there. I mean, you can take a phone into your primary care can bring it in and record the entire conversation. It's not just recording it, it's taking that information, consolidating it into a note that the physician can review. And it's already saving physicians large amounts of time. Well, now if you take that and you think about also agentic AI, where you are allowing it to do some tasks autonomously in order to have get to a goal. Think of prior authorization. So now, like, I'm a primary care doc, and I'm talking with my patient who's going to need this medication or this procedure. The AI can, in part of the ambient conversation, not only record the information, but start to pull information to round out that prior authorization and even kick it off. So I think once we start to take all of these new technologies and put them together, I think there's tremendous opportunity. So I see a path in the next 5 to 10 years to really eliminate a lot of, what gets, again, as I mentioned at the beginning, you want to get a physician riled up, talk to them about prior authorization. So hopefully maybe they'll be riled up about something else instead of prior authorizations.
Most doctors will tell you that the EHR rollout was a disaster because there weren't enough doctors involved in the development process. So, what can physicians do to influence the development of these prior authorization technologies to make sure they better serve their needs and their patient needs?
Yeah, that's a great example. I was at a AI conference a couple of years ago, and somebody from Google, the healthcare arm, mentioned that exact thing. And this is really when kind of ChatGPT hit the stage in 2023. And basically, it was a call to action to the physicians in the room. Remember the EHR, we did not have a voice. It basically was a glorified, billing tool when it first rolled out. That they're better now. But it was kind of this reminder of this is our time to have input on what the next iteration looks like. So I encourage physicians we do like to learn. So I think education is kind of the first piece. really understand, what AI can do, what its limitations are, some of the words that are used. You don't need to be a data scientist, but I think education is key. There are a lot of organizations like the AMA, the American Medical Association, that are working with Congress to ensure that there are processes in place to standardize and improve the prior auth. So get involved with those organizations. And then, like we work with our clients and, kind of, talk with our end users, whether they're physicians, whether they're nurses, case managers, be part of those. If you hear, that they're looking for physicians to be involved in projects, or, something's be willing to be part of that, because that's the only way that your voice is going to be heard. And to be honest, if you are an AI, if you're an AI company, or you're a healthcare system that is using your own resources to build something, you can build the greatest AI model since sliced bread. If you don't think about workflow, you don't think about how the end user uses this and what their day-to-day world is like, you're going to have an unsuccessful rollout. So it's kind of on both sides. I think, those that are building and those that are going to be using really need to partner and be part of the process.
Is there anything else that you would like to mention that you think physicians need to know that we haven't talked about?
I think I think the education piece is key. I think it's recognition that AI is not going away. It's going to be, it's already ingrained in our day-to-day life. You can't, open up your phone without some piece of AI assisting your day-to-day life. It's going to become more integrated into healthcare. So I think education is key. But I think it's I think the other thing to consider is there's a lot of fear out there. There's fear that it's going to take your job. It's not going to replace a physician. It is not going to replace a nurse. I think it's recognizing that there's the potential to make your life better by augmenting what you do. So I think when people kind of get past that fear factor, they're more willing to work with the technology. I also think there is, you can hear all these stories in the news, and they tend to gravitate towards, the extreme sometimes in the AI stories, and that people kind of get scared. There are risks associated with AI. I think you need to recognize what those are. But I also think you have to, recognize the benefits, and that healthcare is not perfect. So mistakes are made through manual processes. And even if the AI is not perfect, in a lot of cases, it is better than the manual processes. And so it's being part of that conversation, and, through transparency, and, recognizing that it doesn't need to be perfect in order to provide benefits and move the needle forward.
Very good. Doctor, thanks for joining me today.
Oh, it was nice to meet you, Todd.
Again, that was a conversation between Medical Economics Managing Editor Todd Shryock and Dr. Heather Bassett, Chief Medical Officer of Xsolis. My name is Austin Littrell, and on behalf of the whole Medical Economics and Physicians Practice teams, I'd like to thank you for listening to the show, and ask that you please subscribe on Apple Podcasts, Spotify, or wherever you get your podcasts so you don't miss the next episode. Also, if you like the best stories that Medical Economics and Physicians Practice publish, delivered straight to your email 6 days of the week, subscribe to our newsletters at medicaleconomics.com and physicianspractice.com. Oh, and be sure to check out Medical Economics Pulse, a quick-hitting news podcast that offers concise updates on the most important developments affecting your practice, your bottom line, and the broader healthcare landscape. delivered by the editorial team at Medical Economics. Off the Chart, a Business of Medicine podcast, is executive produced by Chris Mazzolini and produced by Keith Reynolds and Austin Littrell. Medical Economics, Physician Practice, and Patient Care Online are all members of the MJH Life Sciences family. Thank you.